Hey everyone, and welcome back to Medical Knowledge TV. Today we're diving deep into a topic that affects us all: pain. Whether it's a stubbed toe or a chronic condition, pain can have a huge impact on our daily lives. We'll explore different types of pain and ways to manage it, including medication and non-medication options. Let's get started. So, what exactly is pain? It's a question that has puzzled humans for centuries. It's more than just a physical sensation. It's a complex experience that involves our entire being. Pain is a complex interplay of physical, emotional, and psychological factors. It can affect our mood, our thoughts, and even our social interactions. Imagine touching a hot stove. The immediate reaction is to pull your hand away. Pain receptors in your skin, called nociceptors, send an electrical signal to your brain. These receptors are specialized to detect harmful stimuli. This signal travels through your nerves, up your spinal cord, and reaches the thalamus, which processes pain. The journey of this signal is incredibly fast, almost instantaneous. The thalamus relays this message to other parts of your brain, including the sensory cortex, which tells you where the pain is coming from. This helps you understand the location and intensity of the pain. Your brain also processes the emotional aspect of pain in areas like the amygdala and hippocampus. These regions are responsible for the emotional and memory-related aspects of pain. This emotional response makes pain a personal and subjective experience. Everyone's pain is unique, influenced by their past experiences and emotional state. Pain serves as a vital warning system, alerting us to potential harm and prompting us to take action. It helps us avoid dangerous situations and protect our bodies from further injury. For example, if you sprain your ankle while running, the pain forces you to stop and rest, preventing further damage. This is your body's way of ensuring you give it time to heal. However, when pain persists for weeks, months, or even years, it's classified as chronic pain. Chronic pain can be debilitating and affect every aspect of your life. Chronic pain doesn't serve the same protective purpose as acute pain and can significantly impact your quality of life. It can lead to issues like depression, anxiety, and social isolation. Conditions like arthritis, fibromyalgia, and nerve damage can all lead to chronic pain. These conditions often require long-term management strategies. Managing chronic pain often requires a multidisciplinary approach, including medication, physical therapy, and cognitive behavioral therapy. Each treatment aims to address different aspects of pain. Understanding the science behind pain helps us better manage and treat it. Research continues to uncover new insights into how pain works and how we can alleviate it. By recognizing that pain is a complex interplay of factors, we can move towards more personalized and effective treatment plans. This holistic approach can improve outcomes and enhance the quality of life for those suffering from pain. Let's delve deeper into the different types of pain. Understanding the nature of pain is essential for effective treatment and management. Pain can be classified in various ways depending on its duration, cause, and characteristics. This classification helps medical professionals determine the best course of action for relief. First, let's differentiate between acute and chronic pain. These two types of pain have distinct features and implications for treatment. Acute pain is sudden, sharp, and demands immediate attention, like a fire alarm. It serves as a critical warning signal that something is wrong in the body. It typically arises from a specific injury and serves as a warning signal. Examples include fractures, sprains, and burns. Chronic pain, on the other hand, is persistent, lasting for 3 months or more. Unlike acute pain, it often continues even after the initial injury has healed. It can stem from ongoing medical conditions, nerve damage, or past injuries. Conditions like arthritis, diabetes, and shingles are common sources of chronic pain. Chronic pain can wear you down physically and emotionally, impacting your mood, sleep, and overall quality of life. It can lead to feelings of frustration, anxiety, and depression. Now let's explore nociceptive pain and neuropathic pain. These types of pain have different origins and require different treatment approaches. Nociceptive pain arises from actual or potential damage to tissues in your body. This type of pain is usually well localized and can be acute or chronic. It can be further divided into somatic pain and visceral pain. Understanding these subtypes helps in pinpointing the source of pain. Somatic pain originates from your skin, muscles, bones, and joints. It's often described as sharp or throbbing and is usually easier to pinpoint. Visceral pain arises from your internal organs and is often described as a deep aching sensation. This type of pain is more diffuse and harder to localize. Neuropathic pain originates from damage or dysfunction within the nervous system. It can be caused by conditions that affect the nerves themselves. It's often described as a burning, tingling, or electric shock-like pain. This type of pain can be particularly challenging to treat. Conditions like diabetes, shingles, and spinal cord injuries can lead to neuropathic pain. These conditions damage the nerves, leading to persistent pain signals. Treating neuropathic pain often requires a different approach than treating nociceptive pain. Standard painkillers may not be effective. While medications like NSAIDs might be effective for nociceptive pain, they often prove less helpful for neuropathic pain. Alternative treatments are often necessary. Medications specifically designed to target nerve pain, such as antidepressants or anticonvulsants, are often prescribed. These medications can help manage the symptoms more effectively. Understanding these distinctions is crucial for proper diagnosis and treatment. Accurate diagnosis leads to more targeted and effective pain management strategies. By recognizing the different types of pain, we can develop more effective pain management strategies. This holistic approach can significantly improve patient outcomes. This knowledge empowers us to take control of our pain and improve our quality of life. With the right strategies, we can manage pain more effectively and lead healthier, happier lives. Let's move on to how we can manage pain effectively. Understanding the types of pain is just the first step in a comprehensive pain management plan. Now that we've explored the different types of pain, let's talk about how we can manage it. Analgesics, or pain relievers, are medications specifically designed to alleviate pain. First up, we have non-opioid analgesics like acetaminophen and NSAIDs. Acetaminophen is a powerful pain reliever and fever reducer, commonly used for headaches, toothaches, and muscle aches. NSAIDs, such as ibuprofen and naproxen, reduce pain and combat inflammation. For more severe pain, we turn to opioid analgesics like morphine and oxycodone. Opioids are potent pain relievers that work by interacting with opioid receptors in the brain and spinal cord. Due to their potency and potential for dependence, opioids are typically reserved for moderate to severe pain. In addition to these main categories, there are adjuvant analgesics like antidepressants and anticonvulsants. These medications are often used alongside other analgesics to enhance pain relief, particularly for neuropathic pain. Choosing the right analgesic depends on various factors, including the type and severity of your pain. It's crucial to consult with your healthcare provider to determine the most appropriate analgesic and dosage for your specific needs. By working closely with your healthcare provider, you can find the best pain management strategy. This approach helps you regain control and improve your quality of life. Let's now understand how these analgesics work in the body. Have you ever wondered how these pain-relieving heroes work their magic inside your body? Whether it's a headache, muscle pain, or chronic discomfort, analgesics are often the go-to solution. But what exactly happens when you pop that pill? Let's start with non-opioid analgesics like acetaminophen. This common pain reliever is often used for mild to moderate pain and fever. Acetaminophen is thought to inhibit the production of prostaglandins, chemicals that trigger pain and inflammation. By reducing these chemicals, acetaminophen helps to alleviate pain and lower fever. NSAIDs, such as ibuprofen and naproxen, work by blocking the action of an enzyme called cyclooxygenase, COX. These medications are often used for conditions like arthritis, menstrual cramps, and other inflammatory disorders. COX enzymes come in two main types, COX-1 and COX-2. Understanding the difference between these enzymes is crucial for grasping how NSAIDs work. COX-1 is involved in protecting the stomach lining, while COX-2 is primarily responsible for inflammation and pain. This distinction helps explain why some NSAIDs can cause stomach issues. Most NSAIDs are non-selective COX inhibitors, meaning they block both COX-1 and COX-2. This broad action makes them effective, but also increases the risk of side effects. This effectively reduces pain and inflammation, but can also lead to side effects like stomach upset. It's a trade-off that needs to be managed carefully. Some newer NSAIDs are COX-2 selective inhibitors, targeting primarily the COX-2 enzyme responsible for pain and inflammation. These medications aim to reduce pain with fewer gastrointestinal side effects. Now, let's move on to opioid analgesics like morphine and oxycodone. These powerful pain relievers are often reserved for severe pain. Opioids work by binding to opioid receptors in the central nervous system and other parts of the body. This binding action alters the way your brain perceives pain. When opioids bind to these receptors, they reduce the transmission of pain signals to the brain. This makes them highly effective for pain relief. Opioids also affect the emotional and reward centers of the brain, contributing to their pain-relieving effects. This dual action can make them both effective and risky. However, opioids can lead to tolerance, dependence, and addiction with prolonged use. These risks make it essential to use opioids under strict medical supervision. Tolerance means you need higher doses to achieve the same pain relief. This can lead to a dangerous cycle of increasing dosage. Dependence means your body becomes accustomed to the medication and experiences withdrawal symptoms when you stop taking it. These symptoms can be both physical and emotional. Addiction is a chronic, relapsing disease characterized by compulsive drug seeking and use. It's a serious condition that requires comprehensive treatment. Therefore, opioids are typically reserved for moderate to severe pain that hasn't responded to other treatments. They are a last resort when other pain management strategies fail. Understanding how analgesics work in the body is essential for using them safely and effectively. Knowledge empowers you to make informed decisions about your health. By working closely with your healthcare provider, you can find the best pain management strategy. This collaborative approach ensures that your treatment is tailored to your specific needs. This approach helps you improve your quality of life. Effective pain management is not just about relieving pain, but also about enhancing your overall well-being. That brings us to the end of our exploration into the world of pain. I hope you found this journey insightful and feel more empowered to manage pain effectively. Remember, pain is a complex experience, and it's crucial to listen to your body and communicate openly with your healthcare provider. If you're struggling with pain, don't hesitate to seek professional help. Until next time, stay informed, stay healthy, and take care.